Hello there, my name is Maxim Marshall and today I'm going to be reviewing previous literature on the effects of the absence of carbohydrates on the endurance phenotype. In this short video, I will be covering the following topics: a brief overview of metabolism and the metabolic adaptations to endurance training without carbohydrates, previous literature on the endurance without carbohydrates, and what is currently known about the pros and cons on this topic, and then I will be finishing off with a conclusion. Metabolism is a term describing the chemical processes that take place in an organism. The universal energy currency is adenosine triphosphate, also known as ATP. As ATP stores are limited, the body requires a constant source of ATP. Therefore, three metabolic pathways resynthesize ATP using catabolic reactions. Prolonged endurance exercise induces several muscular adaptations, such as an increase in the density of the mitochondria with the activity of the enzymes such as HAD and citrate synthase being elevated, an increase in capillary density, also known as angiogenesis, shifts in substrate utilization, an improved VO2 max, greater times to exhaustion at a given workload, and finally amplifying the activation of a number of signaling proteins. These include AMPK and P38MAPK. These are two enzymes with direct roles of controlling the expression of the activity of several transcription factors involved in mitochondrial biogenesis and promoting training adaptation. Previous literature has shown that in the ingestion of carbohydrates prior or during exercise positively enhances performance. Less appreciated is the perspective that there is no essential requirement for dietary carbohydrate because humans possess a robust capacity to adapt to low carbohydrate availability. Hansen and colleagues explored the theory that endurance training with restricted carbohydrates may cause superior muscle adaptations. Over 10 weeks, 7 untrained participants performed knee extensions for 1 hour at the 75% of max power output. One leg was trained twice every second day, and the contralateral leg was trained once every day. Before and after 10 weeks, time to exhaustion following knee extensions was measured. Along with this, muscle biopsies were also taken. Here is a specific training schedule that they followed. This table shows change in activity in the two key enzymes of mitochondrial growth. HAD activity increased with training, but only significantly so in the low group, whereas the citrate synthase activity increased in both low and high groups. The citrate synthase activity increase indicates increased mitochondrial adaptation. The percentage number and area of the type 2 fibers decreased significantly in high, but there was no difference between the two legs in post-exercise. This shows after training, type 1 fibers were more prominent in exercise. Although there was no significant effects of training and no difference between the low and the high groups with regard to distribution of fiber types or size, or with regard to capillary density. Time to exhaustion in the low leg improved twice as much as the other leg, with the average increase of around 15 minutes, along with the low leg having a greater increase in muscle glycogen following training. Although we have seen great increases in the low glycogen state, there are some things to consider. The subjects in this investigation were untrained, and it is not currently known whether undertaking training sessions in a lower glycogen state will translate into improved training adaptation and performance in already well-trained athletes. The mode of training and the exercise performance task bear little resemblance to whole body training modes and performance tasks undertaken by the majority of competitive athletes. As training schedules induce chronically low muscle glycogen levels, this may cause a risk in overtraining. As this study did not control which leg was trained, results may have been affected by the neural adaptations or the muscle fiber recruitment due to the use of the preferred limb. Pre-training times show that the time to exhaustion was around 5 minutes. This does not portray endurance training, as previous literature states predominantly carbohydrates are being used when exercise commences. Although they have various adaptations, time to exhaustion does not explain why they kick for longer. It would have been good to see measures of fat or carbohydrate utilization with RER. Finally, participants may have tried harder in certain training sessions more than others, which will affect the results. Moving on, changing our diets is another method of restricting carbohydrates. Work on the metabolic adaptations to carbohydrate starvation revealed an elegant mechanism by which humans switched to using lipid-based fuels. Weeks of low carbohydrate and high fat dieting causes glycogen levels to significantly decrease. This causes ketone production to increase, which displaces glucose as the primary energy source. while energy is predominantly derived from fatty acids. Finney et al. Demonstrated more than 3 decades ago that the consumption of a ketogenic diet did not enhance performance in elite cyclists. More recently, the cross-sectional study conducted by Volek and colleagues compared metabolic differences between competitive ultramarathoners and Ironman distance triathletes consuming either low carbohydrate diets or high carbohydrate diets. In particular, they examined substrate utilization within physiological tests, were allocated into groups according to existing behaviours. The low carbohydrate group, less than 20% of their diet derived from carbohydrates, and over 60% derived from fats. In the high carbohydrate group, over 50% of the diet derived from carbohydrates. In the first visit, participants were tested for the VO2 max and the max rate of fat oxidation. On the second visit, substrate utilization was measured when running for 3 hours. The pre-test shows that the maximum rate of fat utilization in low carbohydrate group was found to be 2.3 times higher. These results can be emphasized by the serum glycerol levels in both groups following endurance tests. The graph on the right represents utilization of fat stores. The low carbohydrate group's results showed that there was greater levels of blood glycerol, and this increased much more quickly compared to the high carbohydrate group. Here, the normal response to exercise is a slow progressive increase in fat utilization, which is shown by the athletes that are consuming a high carbohydrate diet. Although here we see a rapid and a large utilization of fat stores in the low carbohydrate group, we see a rapid and a large utilization of carbohydrates in the high carbohydrate group and a very small amounts of carbohydrate utilization in a low carbohydrate group. Here we see no difference in muscle glycogen at rest or after exercise between both groups. This shows that the low carbohydrate group can still resynthesize glycogen at the same rates, although they are not consuming many carbohydrates. An intervention-based study is needed to show how participants on a low carbohydrate diet performed compared to the high carbohydrate dieters. Also, there are some pros and cons with the low carbohydrate diet that needs to be taken into consideration. An alternative, less extreme, intervention for the promotion of glycogen depletion is performing endurance training in the morning without having breakfast. The study by Van Proyen in 2011 compared the effects of endurance training in fed or fasted states on muscular adaptations. Here, 20 untrained males trained for 6 weeks. In 1 week, each participant performed 2 60-minute cycles or 2 90-minute cycles at 70% of the VO2 max. Participants were split into 2 groups. The carbohydrate-rich breakfast, with 85% of energy deriving from carbohydrates, and the fasted group trained following an overnight fast. The endurance test was split over 2 days, which was performed prior to and post-testing. On one occasion, participants performed a 2-hour cycle with a power output of around 175 watts. On the other occasion, participants performed a 1-hour time trial where power output was self-selected at scheduled interventions, and blood samples were measured throughout the test, along with substrate oxidation rates, oxidative enzymes, exercise-induced intracellular lipids, and capillary densities. The substrate oxidation rates were similar between the 2 groups during the pre-test. Carbon dioxide levels slightly decreased due to training, while oxygen rates were unchanged. Independent of the experimental condition and compared with the pre-test, RER levels were lower in the post-test than in the pre-test. This corresponds with the increased contribution of fat oxidation to energy production in post-training. However, in 2010, Stannard and colleagues has produced some contradicting evidence. While comparing effects of endurance training in fed and fasted states, this time the participants were 8 untrained females and 6 untrained males. All participants trained for 4 weeks. In the first training session, participants cycled for 25 minutes at 65% of their VO2 max. For the subsequent training sessions, duration was increased by 25 minutes, ending with the last week training for 100 minutes. In the fed group, participants commenced training sessions following a standardized breakfast, containing 1.5 grams of carbohydrate per kilogram of lean body weight. The fasted group commenced training following an overnight fast. In the first visit to the lab, oxygen utilization was measured, along with respiratory gases, muscle biopsies and blood samples. The same dieting regime was used in a second visit, where participants commenced a 75-minute cycle at 65% of their VO2 max. Training-induced changes in tracing phase activity and HAD activities were not different between the training groups, but when there was an effect of gender was considered, men responded better to the fasting training and women responded better to the fed training. RER significantly decreased with duration. However, RER of the groups during exercise did not respond differently to training, nor was there any significant influence of gender. Also, fasting training had no effect on plasma glucose, lactate, and free fatty acid concentrations during subsequent submaximal exercise. In conclusion, ingestion of carbohydrates prior to daily exercise can modify some of the exercise training-induced adaptations as compared to training in a fasted state. Also, these adaptations are slightly different between men and women. So, while studies using the appropriate performance measures clearly show improvements in muscular adaptations following endurance training without carbohydrates, failure to confirm in these results may be due to the study design. The mechanisms involved in endurance adaptations still need to be investigated. Nevertheless, the evidence for the great endurance adaptations can't be ignored.